I am now going to share some of the current data describing physical activity levels among children and adolescents, and show examples of youth who meet the guidelines. CDC conducts a national survey that monitors health risk behaviors among youth enrolled in public and private schools in grades 9, 12. Data from the 2007 survey shows that among high school students, 11% of females and 24% of males said that they were physically active at least 60 minutes per day. With such a low proportion of high school students meeting the physical activity guidelines, it is clear that there is a need to help youth get and stay active. National data on physical activity among younger age groups are presented in this table. Among 9-13-year-olds, only 39% said they participated in organized physical activity. This finding indicates a great opportunity to identify ways to provide more organized activity for youth. As we have seen, youth vary in their physical activity participation. Youth who do not currently meet the guidelines should slowly increase their activity in small steps by gradually increasing the number of days and the amount of time spent being active. It is also important for youth to engage in activities that are enjoyable. Both of these recommendations will help to decrease the risk of injury and increase the likelihood of participating in lifelong physical activity. Youth who exceed the guidelines should maintain their activity level and vary the kinds of activities that they do in order to reduce the risk of an overuse injury. Youth who meet the guidelines should continue being active on a daily basis and work towards becoming more active. Evidence suggests that more than 60 minutes of physical activity every day may provide additional health benefits. What are 4 of the 8 components associated with coordinated school health programs? Answers may vary but include the following: health education, physical education, health services, nutrition services, counseling, psychological, and social services. Healthy and safe school environment, health promotion for staff, family and community involvement. How is health-related PE different from school PE programs in the past? Health-related PE promotes public health objectives and focuses on the health benefits of physical activity. This focus on behavior rather than physiological status is important, because for many years, school PE was primarily focused on sport performance and yearly fitness testing of students. How might school-based fitness testing promote physical activity? School-based fitness testing like that used in the Fitnessgram and the President's Challenge may require teachers to increase the amount time spent in PE class engaging in moderate to vigorous physical activity, which can improve students' fitness levels particularly if they are inactive. The idea is that testing health-related fitness parameters will help integrate behavior, fitness, motor skills, and cognition to encourage more physical activity in and out of school. Policymakers have used fitness evaluation results, at least in part, to make the case that children and adolescents score low on health-related fitness, and therefore need to become more active and fit. Thus, very inactive children may do very well on school field tests of physical fitness, whereas others who may be meeting or exceeding the guideline of 60 minutes a day may not do well on some or all of the tests. It remains to be determined whether physical fitness testing of children and youth promotes more physical activity in these groups and whether the strategy has a significant effect on the prevalence of obesity, overweight, and diabetes. What are two common strategies to increase vigorous or moderate intensity physical activity in school PE programs based on the community guide recommendations? Answers may vary but may include the following: just rolling out a ball during a PE period or having students shooting basketballs one at a time are examples of inappropriate physical education. The community guide evaluates high-quality physical education programs that include all students, have appropriate class sizes for instruction, use developmentally appropriate curricula delivered by trained physical education specialists, have adequate equipment to meet educational goals, focus on an appropriate mix of motor skills, increase students' understanding, and provide active opportunities to practice. During the preschool and elementary school years, school-based programs to increase physical activity should emphasize general physical activity and improving the motor skills locomotor, such as traveling, fleeing, and dodging, non-manipulative, such as jumping, landing, and balancing, and manipulative, such as kicking, throwing, and catching. Once students reach the ages of 10 to 14, the emphasis should shift toward a variety of individual and group activities, including school and club sports. The guideline for physical activity participation for children and adolescents above 5 years of age is 60 minutes daily of vigorous or moderate intensity activity. Significant gains in youth physical fitness, cardiorespiratory, and muscular strength can be obtained by participating at least 3 days per week in vigorous intensity aerobic activities, and by performing resistance training 2 or 3 days per week. The emphasis for young adults should be on health, fitness, and behaviors that can be adopted and maintained into adulthood. What are 4 positive outcomes of school-based PE related to increasing student physical activity levels? Many studies have demonstrated significant gains in physical fitness measures, cardiorespiratory and muscular, in children and adolescents who participated in vigorous intensity aerobic activities 3 or more days per week, and muscle strengthening and bone strengthening exercises 2 or 3 days per week. Cardiorespiratory health and metabolic health are also significantly improved by taking part at least 3 days per week in vigorous aerobic activities. And bone health responds positively to weight-bearing activities performed at least 3 days per week. There is growing evidence that participation in school-based physical activities like PE not only doesn't hurt academic scores but actually may improve them. When reading the text, you will need to know the below question. What is SPARC? What did it find? What are the opportunities for school-related physical activity? There are many opportunities out there, such as physical education, after-school physical activity programs, classroom physical activity programs, recess and before-school programs. What 2 or 3 factors do research-based school physical activity interventions have in common? Answers may vary but may include the following. Most research interventions promote the use of enjoyable physical activities during PE classes coupled with teaching movement skills, includes teacher or teacher aid training. Children are encouraged to be active in vigorous or moderate intensity physical activity for most of a PE class period. Approximately 50% of the time is devoted to health-related physical activity, and 50% of the time is devoted to skill building. In addition to health-related physical activities, skill-related sport programs that emphasize self-management skills and also have homework designed to engage parents are involved. The exercise-related benefits for children, adolescents, and young adults are highly dependent on individual growth and development. Most youth can experience the very positive benefits of engaging in physical activity and exercise. However, maturation can influence the rate and timing of these training adaptations. How do growth and development issues influence youth fitness and physical activity levels? Answers may vary but may include the following. Important considerations concerning physical activity promotion in children and adolescents are their individual growth trajectories and the fact that older children have better motor skills than younger ones. We all know that some children mature faster than others. For example, 14-year-olds have better gross motor control, more muscle mass, and generally higher fitness than younger children. This difference in physical abilities due to growth and development can affect many aspects of physical activity behavior, both physical and psychological.